Hello, my name is Anabelle, a third-year undergraduate at UAB working in the Heinemann Lab. The topic of my research is kidney expression of the endothelin system following cisplatin-induced acute kidney injury in male and female mice. Cisplatin is a chemotherapeutic drug used in the treatment of many cancers, but it has been found to be nephrotoxic. It can accumulate in the proximal tubules of the kidney, leading to the progression of acute kidney injury or AKI. Previous studies show that young female mice show greater protection and recovery from cisplatin-induced AKI in comparison to young males. Additionally, it was previously determined that male mice show an increase in whole kidney EDN1 and no change in EDNRA or EDNRB 3 days after an injection of cisplatin. Currently, it is undetermined if the endothelin system is significantly affected in female mice or within the different regions of the kidney post-cisplatin. We hypothesize that cisplatin AKI male and female mice will have an increased expression of the kidney ET system. To test this, we gave male and female 9-week-old mice a single IP injection of either saline or 15 milligrams per kilogram of cisplatin. 3 days later, we euthanized the mice and collected their blood and kidneys. We measured the levels of plasma creatinine in the blood to determine kidney function. One kidney was used for histological assessment, and the second kidney was dissected into the cortex, outer medulla, and inner medulla. RNA was extracted from each of these sections. The RNA from the cortex and OM was converted to cDNA for real-time qPCR. Primers were run for each of the different transcripts of the endothelin system peptides, converting enzymes, and the 2 G protein coupled receptors. The RNA from the IM was used for total RNA sequencing, but the analysis is still pending. When looking at the plasma creatinine levels, we used a two-way ANOVA to compare cisplatin, sex, and the interaction between the two groups. We found that mice injected with cisplatin showed an increased amount of plasma creatinine in the blood regardless of the mice's sex. We had also found that in both sexes, cisplatin caused kidney damage such as dilated tubules, loss of proximal tubule brush border, and protein casts. Two-way ANOVAs were also used to compare the cisplatin and sex groups when looking at cortical and OM expression of the ET system. In the cortex, cisplatin led to an increase of EDN1, EDN3, EDNRA, EDNRB, and EASE2. EDN2 was not detected, and EASE1 was not significantly different in any of the groups. In the OM, cisplatin caused a decrease in EDNRA, and EDNRB was significantly higher in females compared to males, regardless of cisplatin. EDN1, EDN3, EASE1, and EASE2 were not statistically different among any group. To conclude, cisplatin caused changes in the ET system regardless of sex. The direction of future experiments can determine if these changes correlate with kidney injury and whether the ET receptors are good candidates as therapeutic targets to prevent cisplatin-induced AKI.